Tahlea, great to chat again. Solomon Islands, it's really running out of control there.
It really, really is. And they have confirmed that it is the Delta variant. Samples were sent. So they're actually dealing with Delta when everyone else is dealing with Omicron.
Yes.
Absolutely, and super contagious. So it is really concerning, and it is spreading. Out of the 9 provinces in Solomon Islands, 6 have been infected. Only 3 are COVID-free. So there was an announcement today by the Health Minister of another 349 cases. 81% of those cases are in the capital, Honiara, and it brings the total number of cases in the Sols to 3,667. And you have to remember that this outbreak only really started kicking off in mid-January. He also announced in the announcement tonight that Malaita province is now really an area of concern. They're sending PPE and RAT tests to the province. But like I said, huge concern of just how it is going around and transmitting to people. They're also saying, unfortunately, 40 people have died, but they're actually expecting that number to be a lot higher because people have died at home and it just hasn't been reported. We know that Solomon Islands has a really low vaccination rate. It's only around 11% of the population that are double vaccinated. And this outbreak has been kind of like ironic in a way because it means that more people have gone to vax centres to go and get tested. But pictures that circulate online at those vax events show people not wearing a mask and not social distancing. So, of course, again, expecting it to get worse. The Asian Development Bank announced yesterday a $5 million grant to the Solomon Islands government to help them control the community transmission of COVID. But in an address on Sunday, the Prime Minister, Manasseh Sogavare, kind of warned the country that this is going to get worse before it gets better. At that address, he was saying that 1 in 2 people in the capital have COVID.
Well, that is extraordinary. So I wouldn't be surprised if they're going to need international assistance very soon.
And Australia did send a team in January, but yes, I feel that there might be some more people who need to go.
With those kind of numbers. Now, the numbers in Tonga are small, but this is a very vulnerable community at the moment.
Yeah, and we just have to remember it was only just 3 weeks ago that Tonga saw the volcanic eruption, tsunami and subsequent earthquake. And during that time, even when they were talking about recovery and, of course, international forces coming in to provide aid, they were really worried to say that we want to remain COVID-free because they have been relatively COVID untouched. Unfortunately, that hasn't been the case. The Kingdom now reporting at 14 cases and the government extending the lockdown for another 2 weeks. The Prime Minister, Huakava Meiliku Siosi Sovaleni, announcing 6 cases today. 4 were in the village Vaini and 2 were in the village Pili. Both of those villages are now considered red zones and they are roadblocks. It means that, you know, people can't come in and out. So of those 14 cases, 13 are active, 1 recovered but remains in isolation. Of course, this kicked off because there were 2 port workers at the Queen Salote Wharf who tested positive. Now, samples for those cases have been sent to Australia to try and determine both the origins and the variant that we're talking about in Tonga, and those results are expected at the end of the week. The Prime Minister did say in an interview that he doesn't believe that the COVID came from the crew HMAS Adelaide, the Australian crew who went to deliver aid to Tonga. That was because 1, it was completely contactless, and 2, they were at a different port. But it will still be interesting to see who brought it in. The one good thing that they've got going for them is that they do have good vaccination rates. Nearly 90% are double vaccinated.
Well, that's really impressive. Now, Papua New Guinea doesn't have high vaccination rates. The Prime Minister came back early. He had gone to the Beijing Winter Games because he caught COVID, and then he was caught up in a furor over whether he was really isolating or not.
Yeah, it was interesting because James Marape, the Prime Minister of PNG, said he was satisfied with his trip in China, but people in the country, especially the opposition leader Belden Nama, were not satisfied upon his return back to PNG. There were rumours that he was not isolating and that he was at a golf course. There was a media statement from Belden Nama essentially saying, "Prime Minister, where have you been?" And local media were really putting pressure both on the Prime Minister and the Prime Minister's office to explain just exactly what's going on. The Prime Minister, James Marape, did release a statement tonight. He said that 1, he is recovering well, and 2, that he was indeed isolating. He says that all his official duties are now being taken up by the Deputy Prime Minister, Sam Basil. It was also interesting in this this release because he took it as an opportunity to encourage Papua New Guineans to get vaccinated. He said the only reason why he is feeling so well is, one, because of God, because he does say that PNG is a Christian nation, and two, is because he got double vaccinated. So he is encouraging people to go out and get vaccinated. It's kind of interesting, though, because we know that PNG has been really grappling with COVID in the country there. And the Port Moresby General Hospital in particular, at the start of the month, 75% of their staff were COVID positive. And today a doctor has come out and said that they are running short of just generic supplies and drugs, saying that they don't have saline fluid for their IVs and they don't even have the sterilising drug in the operating room, meaning they just really have to make do by washing and drying the equipment on their own. They say the hospital's working out, but it is a question of finances, which is interesting because PNG does go to their general election in June, and of course COVID-19 and the government's handling or not handling of the crisis will definitely be something that voters will be thinking about.
Yes, Tahlea, great to talk. Thanks so much for coming.
Thanks, Bev.